Good evening. Today we continue from where we stopped on Sunday at 3 p.m. But I want to backtrack a little and explain to you the COVID process so that you can avoid it and you will have intelligent understanding. Fear will go out because when you know something, you can deal with it rationally. So COVID infection is caused by SARS-CoV-2 virus. It enters the body usually through the nose, throat, and the COVID spike protein, S protein, attaches to the ACE2 receptor, which is found in the upper respiratory tract. And depending on where else the ACE2 receptor is more distributed, a patient may have early symptoms. So you already know, maybe knowing that people with diabetes, because of the fat cells, and people who are obese tend to have more of the ACE2 receptor. So those who have comorbidities need early treatment. Everybody needs early treatment, but those who have comorbidities like diabetes, hypertension, immunological problems need renal issues, past cancer treatment or whatever, need early treatment more. So one of the questions we were ready to answer was how to prevent lung damage. For that you need to know the process. So when the virus attaches, viral spike protein attaches to the ACE2 receptor, it enters the cell and it begins to multiply in the cell and it begins to move from cell to cell without coming into the what we call the interstitium. That is, between cells there's a space where antibodies work. But this virus goes from cell to cell through a connection called the syncytium. Now some common the process is, so once the virus starts multiplying and the spike protein is engaged by antibodies of the body. Initially there are natural killer cells, T cells, that also engage, but antibody response develops. So then what are the initial features? In this present scenario, in this present season, they found that some people get worse within 4 days, the lung gets involved. Second scenario they found was that people seem to be all right, but on the 8th day, 7th evening, often in the 7th night, they get difficulty in breathing. Now how can we prepare for the moment that difficulty comes on? That difficulty meaning that the lung has got involved, the first throat gets involved, then down the tract it gets involved. When the lung gets involved, how can you know it early? Before the blood vessels in the lung begin to form thrombosis, that is blood clots. So here is the progression. The virus enters the throat nose area, then virus begins to spread inside the respiratory epithelium, and by that time you may get fever or you may not get fever. So one question asked was, will you always get fever? You may not get fever. So the fact that you are not having fever is, you can't say I didn't get COVID. Important thing is, if you had a first level close at hand contact, speaking to someone virtually face to face without keeping your distance, now you're asked to do double mask and even face shield, even going to the supermarket or whatever it is. So you will best know that you did have a close contact. So when in that scenario, what often people said is, before the temperature came on, they felt a real feeling of unwellness, that energy drained out. There is a moment or there's an hour that happens, you must recognize it. There is quite a characteristic, felt I can't do anything kind of feeling. Then you may recover, gather strength and so on. Now by this time you would have done steam inhalation, done your kottamalli and done your citrus fluid and different things. But you would have had this feeling of feeling hopeless. Then some people say mouth became very, very, very bitter, and some people say lost the appetite completely. It may happen later or it may happen. Then of course fever may be there. Then we come to the point where you will start a throat scratch or so on. So if in these days if you have fever and you get a throat scratch, you have to think COVID. Now about 3-4 months ago, there was a little infectious mononucleosis, that's another old viral disease that went around, which gave a sore throat, and some people when they went to do the PCR test, it was negative. So it was a different kind of viral thing. Then about 2 months ago, children were getting a upper respiratory tract viral infection, which was also not COVID. But these days, when you do have a upper respiratory thing and gets fever and a throat scratch, you have to first think COVID. Now, a lot of sneezing is usually not a part of COVID. So then we are looking at this feeling drained out. 2, then there may be a time had no fever, and if by the 5th, 6th day fever picks up suddenly, or if you had low-grade fever and fever came on, fever went very high, then that is an indication that you are getting into the dangerous phase of lung involvement. So this is what you have to watch. This is what you have to watch, that lung involvement, to recognize it early. So there are other thing in this present episode. Some people got loose stools because ACE2 receptors in the gastrointestinal tract, alimentary tract got involved, and you may get a diarrhea. The cough may be productive, may not be productive. Then other dangerous sign is you initially have a throat scratch, then you have a superficial cough, then a day may come you feel like you have to constantly do that. Now, while those symptoms are, then if there's a sudden headache, then you have to know that there might be something more happening even in the brain. Then you know at these stages you must definitely see a doctor, call on a doctor. Now, I have an early treatment schedule available. By the way, I am Dr. Lalith Mendis. My last substantive post was as head of Department of Pharmacology in a state medical faculty. That's why I have been speaking a lot on pharmacology. If you need to see a doctor. Now, if you send your doctor's telephone number to me, I can send him certain medical details that he needs to be aware of. Some of those medical details I won't be able to give to you. What I can give to you today, I will give. If you send me a WhatsApp to my WhatsApp number 076 313 4800. 076 313 4800. Please don't call me, I will not answer. Just send the WhatsApp number. Of course, you can send it to the any question, you can send it also to the email that you registered with. Now, there's a response sheet available in this webinar form. So you can put your questions down there, and they will appear before me. So that I can ask some of the questions, but I want to keep the timeline so that let's progress. So we were at the point that if a fever spike or headache or that cough getting going deeper are danger signs. You must definitely consult a doctor. And with the first sign of fever, when COVID is suspected, there's an early treatment regime available. Now then, next stage we want to get on to is what you can do early. As I told you, the headache is also a danger sign. What you can do early is the usual citrus fruit. Someone has asked what you can do to boost immunity. You must take vitamin D, either a monthly dose of 60,000. There are strong preparations of cholecalciferol D3, 60,000. It looks like that old yellow colored, gulia, morogulia kind of thing. You take it at the beginning and daily take 4,000 units. Then you need to take zinc. There's a tablet called zinc. That's 50 milligrams. vitamin D and zinc are useful, and it in fact affords some immunity as well, because in the body, in the COVID process, the body begins to react to the spike protein and other antigens in the virus. So there's an immune inflammatory reaction that goes up like that. Then in it, molecules called interleukins are involved, and one of the most nasty interleukins is IL-6, interleukin 6. And there are different tumor necrosis factor and so on. And then it peaks, and in this well-designed system, there is also how to resolve. The body has a mechanism how to resolve what inflammatory attack that came. You resolve it with pro-resolver molecules, specific pro-resolver molecules, SPM. Now, one such is interleukin 10 and interleukin 4. Those put down the unnecessary action. You know, it's like a fire, it's like a firefight with the foreign antigen, but it must go down. That go down process, which is called resolution, resolver molecules, are dependent on vitamin D. So taking vitamin D in the acute attack and even before that is a way of ensuring that you don't go into the bad part of the COVID reaction. That is why vitamin D and zinc are very useful. Too, vitamin C, 1000 milligrams is also useful, because vitamin C was found in other trials to be effective against respiratory infections. Then in some trials they found if you take low dose aspirin that the thrombosis process will not work, the body will not get into the lung will not get into the thrombosis process. So remember, those can be taken early. There are some other things that can be taken early. Some I can tell you on this webinar. Others you have to get your doctor to send me the doctor's WhatsApp number, then I will send it to him, because some things I can't give it to layman, because your doctor has to decide on certain kinds of drugs whether he will give it or not. But what you must be aware is there are early treatment possible to stop getting a COVID lung. Having got COVID infection, you don't have to have a COVID lung, or you don't have to have the COVID infection infiltrating your lung. It can be stopped before that, which means you will not get hypoxia, that you don't have to get low oxygen, you don't have to get that lung phenomenon, which is actually not a pneumonia, it is a pulmonopathy. Let me explain what happens when the COVID virus has gone down into the lung tissue. Then what happens is, I have explained this before, I want to explain it today also. This is the alveolus, you know, those little air spaces into which you breathe the air in, and oxygen has to go into the blood vessel like that, and carbon dioxide in the blood must come out. So when the COVID attack happens, or the COVID reaction happens to the spike protein, body makes antibodies, and in the membrane between the alveolus and the capillary, which is called the alveolar capillary membrane, this black thing I am demonstrating, this gets thicker and thicker with the immune inflammatory, what we call the exudate. In that there are cells, there are antigen-antibody reactions, substances called cytokines and so on. So then what happens is the oxygen can't go into the blood, carbon dioxide cannot come in. At that stage, the the arterial oxygen will begin to drop. So the important thing is, from the time you have this fever and so on, and there's quite a bit of delay now for PCR testing to come. Remember, before you should do a PCR test, but before it comes or before you go for it, you must be in touch with your local usual doctor, family doctor, and do what he says to do. And I like you to tell him, if he wants to learn, if he wants to get to know a little more information up to date, what the trials are doing, to ask him to please send me his mobile WhatsApp number. Some of them may be my students in the faculty. So when this membrane gets thick, oxygen can't get in, carbon dioxide can't get out. That causes the first part of the COVID lung problem. Then what you should do is, from the beginning of little bit of fever and not feeling well, you must do your breathing exercises. What does that mean? You take deep inhalation, deep breath, and start counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 in that measured way. Do that even 3 times a day. So on a certain day, I told you, especially some people get worse on the 4th day, some people are all right seemingly, but on the 8th day, usually 7th night, they get into problems and find breathing difficulty. So before that happens, you can keep counting like that. So at one point of time, you will find that you can't count up to 10. Then you know the problem has begun. Or you may find climbing the stairway, you feel a little breathless. Or doing your normal homework, you feel a little breathless kind of thing. Then you know the lung is getting involved. So when that part of the lung involvement happens, the initial stage, if you take a drug called doxycycline, now you can't take drugs. Doctor must order it. And that old antibiotic has certain immune effective action against the interleukin 6. The greatest troublemaker is this IL-6. It causes the lung. So there's a legitimate, for our defense, a body action of immune inflammation. But when it goes to overdrive, it is called the cytokines, those molecules which were supposed to protect us from the invading antigen, the COVID spike protein. Those molecules that are formed begins to attack the lung tissue. So when the ACE2 receptor inside the capillary wall, which is called the endothelium, is attacked, inside the capillary wall gets damaged. Inside the capillary wall gets damaged, and at those points, platelets and other thrombosis forming phenomena happen in the lung. At that stage, the hypoxia gets bad. The oxygen suddenly drops. You get breathless. So one intention is to prevent that happening only with the legitimate immune reaction. For that, there are immune modulators that can be given. 2 very well-known immune modulators, which were old drugs used for different purposes. Now they are repurposed for this purpose. So that information I cannot tell in a public webinar. You must get your doctor to contact me. I mean, it's all free. I will just send what I have prepared for what a doctor should know. But what you can know is that you can check with him that you heard like this old drug called doxycycline. When your doctor prescribes that, it will prevent this lung thing getting worse and worse and worse. I also mentioned low dose aspirin, the simple thing that people take for heart treatment, that is also effective. I have already mentioned vitamin D, where zinc and vitamin C are also useful. Then there's another old drug, promethazine. It's a histamine 1, histamine 2, H1, H2 receptor inhibitor. What goes on in the lung tissue will be put down by that. Promethazine, 25 milligrams twice a day can be taken. That also, when taken early, protects the lung damage. Why should you prevent the lung damage? Because if it goes on and on, blood clotting happens inside the capillaries of the lungs. Then at a certain point, a cytokine storm happens, and then antibodies formed against the viral spike protein will go and attack other proteins in the body in other organs, and then it becomes what is called a disseminated attack. And in different other organs, there can be clotting happening. Then it's a very serious stage. At that stage, when you go to hospital only, doctors will give a drug called dexamethasone and blood thinners, but that is hospital treatment. You don't attempt that outside. So now I am only telling you what a doctor can do for you outside the hospital. So before you need hospital treatment, how to prevent the COVID damage is the emphasis of this seminar. So I think I have told you those things, the basic timeline of how to prevent lung getting too involved, how to prevent the blood clotting phenomenon of the lung. Then of course we are all very conscious that you have to prevent that blood clotting nature developing in other organs like the kidney or the heart or the brain or the pancreas, and further damage of organs must be prevented. But today's talk is about the initial prevention of the lung damage and the clotting phenomenon in the lung. So that's about my talk today. Are there any other, there's a question, what is the medicine we can take to boost the immunity? It's not medicine really, it is what you daily take, and Kotamali is known to be quite good for immunogenicity. So I have based my talk on the fact that though it may be some kind of other fever, you better be careful that when a throat scratch is there, treat it like COVID and go to your doctor and ask for the early treatment that is available, which can prevent your lung getting damaged, which can prevent you needing oxygen, which can prevent you having to go into intensive care unit and needing ventilation. All that can be prevented by taking early medicine. Then of course, as I told you, people with diabetes and people with hypertension, kidney disease are more prone to COVID getting worse. It is also known that men get more severe attacks. Then certain blood group has a predilection to get a bad attack. So those you can't help, you're male or female, your blood group is done and finished. So that's most of my talk today. Then I want to move into another problem of this time, that is how you deal with your children. I get a lot of children requests from parents. Dad, I have to say that this is a time you must get close to the son and daughter, because they are losing motivation. They are a lot online. So this was my research subject for the last 5 to 6 years. I presented my innovative method of treatment called empathic motor therapy, how to use grips and ropes to keep children in their studying mode. And that seminar is available on print. I can send you the e-soft version, the e-copy version to you. If you would send me a WhatsApp number, or you please write to the email with which you registered, we can send you that document. Then I have many clips on how to handle children, their sleep time, meal time, how dad needs to coach them now, keep a happy family hour at 7 p.m. The keeping children's motivation is very important. Very quickly, five golden laws of the digital screen. From 6 p.m., the body begins to secrete melatonin, so to see sundown is very important. Kids playing outside on a grass patch, at least catching sundown from the window is important. Don't be on the screen at that time. Prohibit screen from about 5 to 6, They need to catch sundown and get ready for their night time of brain preparation. It is all design. I believe a very wise designer has given this to us very well. We should not get it messed up, and we need to encourage our children on that. So after 6 p.m., minimize digital screen activity. Now I know that some schools have online classes, and even tuition teachers have online classes after even 9 p.m., which is not a good thing. Then, as I said before, please try to get an old laptop which is not smart screen, not pixel screen, but LCD screen, or old desktop for your work, because smartphones, iPad and tab are very pixel intense. PPI is very high. So you need to take care of that. Then what you need to know is that at meal times, please don't use the screen. Meal time is the good habit forming time. Whatever you do at meal time, it becomes a habit. So let's form good habits at meal time. Then you must get them into the studying empathic executive mode, working with their prefrontal cortex. So prefrontal cortex works on attention, that is involved in all the studying and planning, initiation, navigations, successful end conclusion, good reward. So I have done 192 clips on these subjects. You can have them one by one, all free, if you would contact us and keep contact with us. So at mealtime, you can't be using the screen, which means you can't be using your smartphone. Otherwise, people will pick it up. In Sinhala we say, "Owa denu parahata tama sammate pita sita." You can't be like the crab, going crooked and teaching children how to go straight. When their sleep time is well kept, they have their NREM sleep without dreams and REM sleep with dreams, 4 cycles of it, and that's how the brain gets ready. The brain has a system called the glymphatic system, where glial cells of the brain move, removing additional neurochemicals and so on, gets brain ready for next day. Not only that, storage of brain function, the memory, RAM memory, is transferred into deep memory, so to say, with that melatonin action on the brain. Then the child wakes up in the morning very refreshed. Even if an adult is too much on the screen in the night, you'll wake up in the morning having not had your proper physiological sleep. Then the other fact is that reduce LED light where your child is studying, no LED light in the bedroom or in the washroom, because the blue frequency of the LED light affects memory, affects sleep, it disrupts melatonin action. Then early morning, wake up with sunrise is important for the day program to be set off. If you or your child wakes up with a kick start at 8 a.m., missing sunrise, when you wake up like that, then the body has to suddenly get its chronobiology going, which is not good, which predisposes to diabetes and different other things. So remember that also. There are many other things about the digital screen. What you should do is try to get this book when shops are open, from Saraswati bookshop or Vijayapa bookshop or our own bookshop down Serpentine Road. It's available online also. This Screen Smart. Then I have this book, which is this Let the Children Come to Me. Then Parenting Heart and Brain in a Digital Age, very important topic. How to coach your child. Dad, you have to be involved in it, because mom makes it daily safe. Dad gives the next step and next stretch. This is an important subject parallel to COVID, because so many children are now having to do their studies online. Then I have, this is on right learning and recovering childhood. The foreword to this is written by Warden of St. Thomas's, my school, and also by the dean, former dean of the medical faculty. So that's about it for today. If you have any other questions, you can always fill the form below the webinar registration. Write your questions there. Please explain how to take vitamin D3, 4,000 milligrams daily. Once you take the 60 it's not milligrams, it's international unit. Once you take the 60,000 international units for the month, you can top it up with 2,000 international units daily. Then add to it zinc, the tablet of zinc every day, because zinc has a particular immunogenic action, especially against viruses. That metal zinc is protective. There are other zinc preparations connected with brand names, which I normally don't mention in a webinar like this. They're also okay. Yes. Any other questions? You can send if there are any other questions. Yes. What is the quantity of vitamin D and zinc tablets? So vitamin D daily dose is 2,000 international unit. Zinc tablet is 50 milligrams. Doctor, is vitamin D has to be taken in what dosage? We are taking 1,000 on daily basis. That should do, but supplement it once a month with a 60,000. Okay, supplement it once a month with a 60,000. As I explained to you, when the immune inflammatory reaction is going up, there are certain molecules to bring it down. Those molecules are dependent on vitamin D. That's why in the first wave they found vitamin D deficient people did not do well. Then our country, many people have got BCG. BCG vaccine is also protective against this viral infection. BCG promotes cellular immunity. I think that's about it for today. Few more questions to be fielded.
What can be done first when we contact COVID patients?
What can be done first when we contact COVID patients? Of course, you should have been careful to keep your 2 meter distance, double mask, face shield. Even going to a shop nowadays, you must keep your face shield on. Always keep sanitizer and keep your fingers to yourself. Wherever you go like this. You look like praying, but that's okay. Go like this, so that you keep your fingers to yourself. If your face shield is on, you don't touch. So when you go out and come, it's always good to do steam inhalation, deep steam inhalation without burning your nose. Some people do kotamali inhalation also. Then drink some kotamali. It is recommended even in government treatment centers for coriander. Coriander is used, a thick solution of coriander. What else should you do? Then take your, anyway, pear, guava has a thing called quercetin. So daily dose of good fruit is good for immunity, but as I said, vitamin D tops up your immunity. Yes, even pineapple has a thing called bromelain. Less you remove the skin of pineapple, it's more contributive to immunity. Yes. Any other questions?
What can be done to prevent the lung disease?
That's what I said, what can be done to prevent the lung disease. There's early treatment available. Get your doctor to send his WhatsApp number to me. I will tell what he needs to know, which I cannot tell other than a doctor. It will not be right. But there's an old antibiotic called doxycycline, which has been used for a long time. That also prevents the lung damage. Then a little low dose of aspirin, which is usually the cardiac dose, that also prevents lung damage. That's what I can say. Then vitamin D and zinc I have told again and again, that can prevent lung damage. That's it for today. We hope to meet with you again soon. Send your questions. So thank you for listening. I trust this helped you.